and great to be here. Good morning. I know we're running over time, but good morning. You're still there. Thanks. Great, because this is meant to be an interactive session. So thank you. My name is indeed Jeroen Maas, working as a director, access to care at Philips. But here I'm for the Digital Connected Care Coalition. The Digital Connected Care Coalition is a member-driven organization, and we scale digital health projects on the ground. Sorry, I'll stay here. We scale digital health projects on. Thank you. I'm a bit mobile all the time. So it's actually the action that sets us apart from others. And that's why we wanted to interact with the Geneva Digital Health Hub and do this interactive session on 9 very promising pitches. Don't worry, only 3 to start with, and then you can go to coffee. There is a task for you here. So after 3 minutes, I'll have a timer, and you help me clap so that people know that time is up and the next one can come. So we can all go to coffee faster. But also, for you, we want your attention because they follow the same format, all the pitches. First, so what's the problem? What do you do to solve it? What is your offer to the audience? So you get 3 offers now in the next 10 minutes. And then, of course, the next question is, what do you ask from the audience? So you don't have to say it straight away. After the pitches, the pitchers will go to the left corner, straight ahead, and the right corner of the room, and you can go there to talk to them. Any questions? You want to go to coffee? But we have very energetic pitches. So can I please have the first pitcher to the front? Mom Care by Femke Hedema from Farm Access. Femke, floor is yours.
Good morning, everyone. I would like to start off with a question. Do you know where you were born? I assume that most of you were born in a maternity ward with a private room, abundant technology, probably a lot of medical personnel. But as you all know, this is not reality for everyone. I remember visiting a maternity ward in Ghana, which was overcrowded, where women were on the floor, giving birth in a pool of their own blood. And that stark contrast, the place where you were born determining the quality of care you receive, is a persistent and unacceptable problem. Every day, 700 women die from preventable causes related to pregnancy and childbirth. 90% of these deaths happen in low and middle income countries. And you heard that, preventable. Lack of coordination across the care system creates fragmentation. Patients get lost, risks are missed, services focus on volumes instead of outcomes. The result, complications that endanger both the mother and the baby. So, what if we could change that, right? What if digital tools couldn't just digitize care, but they could coordinate care around the woman's needs? Connecting patients, providers, and payers across the full maternal journey. That's the vision behind Mom Care. Mom Care has built in Kenya and Tanzania a connected digital maternal care journey to enable value-based care. Since 2017, we have reached over 60,000 mothers, improving continuity and quality of care, increasing antenatal visits and reducing complications. But we want to go further, and we can't do it alone. To scale beyond our own program, we have developed the Mom Care Connected Care Stack, a free, open-source digital foundation designed specifically for maternity care in low-resource setting. At its core is an interoperability layer that enables real-time, standards-based data exchange, and it supports integration of health data across the network, patient engagement through WhatsApp, dashboards to monitor care quality, and AI-driven solutions. It's modular, it's adaptable, and it's built to connect with national systems or be tailored to local realities. I'm here to invite you to use it, to build your own patient-centered care journeys, to share feedback, improve it, and grow a community of solutions that deliver better care for all. Everyone, deserves to be born into a system that delivers quality of care. The connected care stack is just the start. Let's use it to transform maternal health together.
Well done, well done. We made a promise to the audience. So second pitch that we will have now from Thomas Lamp will be as strict as we were with the first one. So Thomas, the floor is yours.
Perfect. Thank you very much. Hi, everyone. My name is Thomas. I'm the co-founder of a company called Upleap. We're a spin-off of ETH Zurich and the University Hospital in Zurich. And what we're trying to do is integrate medical training into everyday practice of healthcare professionals. So why medical training? One of the medical doctors that we're working with here in Switzerland, keep that in mind, once told me, if I ever get sick, I have my own blacklist of medical doctors that I do not want to treat me. And well, I find that a little bit concerning. So I dug deeper, and numbers show that 40 to 50% of medical professionals are not really confident or not really comfortable in treating or in their everyday practice. So that's also quite a huge number, I thought. So I dug deeper. And the WHO says 8.2 million people die every year because of preventable medical issues which relate to training. So medical training is indeed important, but what's the issue there? So current medical training is often very much ancient, I would say. So there's a classroom lectures, I think everybody knows that, very theoretical, not really applied. E-learning, you know, these PDFs, and then you answer 5 quizzes, half an hour, sit in front of the laptop, also not very applied. And then you have training courses where people go once a year, once every 2 years. So they're not very frequent, they're super expensive, and there's very little in between. So this is what we're trying to do with Upleap. We provide an AI-driven platform that provides scenario-based, short, practical medical trainings that are integrated into doctors' everyday work. We call it like a Duolingo for medical. If you've used Duolingo, you know the principle, right? Instead of doing like a one-day course, you do it like 5 minutes every day. So this continuous repetition makes it work. So it's a mobile-first approach. It's an app-based approach. It's due to that very much scalable, hands-on, and context-specific. And we're piloting that at the moment around 8 countries, including South Africa, Kenya, Zambia, which is also where you see this picture here. So that was taken by my colleague Leonie last year in Zambia. And this is how you see how it works. So the app basically provides guidance to medical professionals to go through interactive scenarios, either by themselves or in teams, as you see it here. So none of them is a medical trainer, but what they do is basically they guide each other through that medical training, and in the end they discuss and they get guidance by the app. And that's a great success. So they're currently rolling that out, or we're rolling it out together with SolidarMed in 50 different hospitals, and hope to expand that. So basically what we expect to be the outcome or the impact of this is, of course, you get improved clinical confidence, onboarding procedures go much easier. You hopefully reduce the preventable medical errors, and healthcare professionals are the backbone of the healthcare systems. So if you support them in their daily work, you strengthen healthcare systems themselves. So what we offer is our AI-driven platform. It's live, it's open, either for individuals or for teams. We have preloaded scenarios, but also, as I said, we use AI to generate customized scenarios. So all the trainings are very much individualized to the specific areas. And we invite everyone to, time is running out, but we invite everyone to join us. So if you want to test it, happy to talk afterwards. Thank you.
Thank you, Thomas. Thank you. So Thomas will be at the back of the room afterwards. And then we go to our third and last pitch of this round, which is by Matt Riley of Philips.
I can use this, Jon. Okay. Hi, everybody. Good morning. It's an absolute pleasure to be here and to follow on from all of these amazing presentations and digital innovations. And hopefully I can continue that theme here. So my name's Matthew Riley. I'm from Philips Ultrasound, and I'd like to talk to you about Smart Sweep, or the project where we're using AI to enable simple assessment of fetal well-being. So I'm sure all of you know that ultrasound is standard of care for antenatal obstetrics, and we have, amongst many other companies, handheld ultrasound machines. Now, that is an amazing innovation and really allows access to care, but in itself is not sufficient. The problem with ultrasound, and I can say this clearly, I've been doing ultrasound for 30 years almost, is that it's operator dependent. And it requires training to both acquire the image and interpret the image. You can see up here, I think it's on your left-hand side, the small image shows a typical ultrasound image. And that actually is an image of a fetal abdomen. Now, what we're trying to do is address that problem. So what we've taken is a series of AI tools that will support the acquisition through simple guidance and audible feedback, and interpret the image so that we can get a very simplistic overview of the fetal position, but also some key parameters that help assess fetal conditions. So what we anticipate is that we'll be able to increase access to quality care, improve the identification of higher risk pregnancies, and support the correct maternal pathway, more confident decision-making at the point of care by frontline healthcare workers, and importantly, remove the barrier of training. So what we've found is that these AI tools can reduce the training time. Typically, for ultrasound, it can be months, sometimes years in the US, to just 1 or 2 hours. So our offer is an AI-supported tool that will support fetal assessment at the point of care in low and middle income countries, tailored for those environments, because we've worked in Kenya, worked in India, we've got data from 3 continents from over thousands of pregnancies, and we're able to deliver a sustainable, high quality maternal ecosystems across the globe. Particularly today, what am I looking for? I'm looking for your feedback, and I'm looking for your help, because what we want to do is scale this solution across the globe in an effective manner. Thank you all very much.